Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Nazer's prognostic index. So Nazer's prognostic index is specifically for the Wilson's disease. And what are the criteria here? The criteria is we look for the serum bilirubin and also the AST, serum aspartate aminotransferase, and the prolongation of the prothrombin time and the prolongation of the prothrombin time. So let's write it down. AST stands for the aspartate aminotransferase. Now let's look at the interpretation of these scores. So in terms, the score is less than 7. So if it is less than 7, we go for MT, that is nothing but the medical therapy. So if it is 7 to 9, what we do is we look for the clinical judgment. So there's clinical judgment, there is either you do a medical or the surgical treatment. So medical or the surgical treatment is done. Next, when you look at a score greater than 9, score greater than 9 is where you do a liver transplantation. To learn and grow daily like this, please do subscribe.